Hi, my name is Cindy Davis, and I'd like to share my teaching experience with you today on my anemia lesson. Bear with me for a second. I am getting my Screencast-O-Matic up for you. Okay, so my introduction of myself. I'm a graduate of Massasoit Community College. I got my associate degree in 2000 and my bachelor's degree in 2012 at Liberty University. I have a smorgasbord of work experience, telemetry, med-surg, clinic, assisted living, home care, geri neuro psych, agency, and private duty nurse. I even put an IV in a cat. Yes, that's a story for another time. So my teaching experience is ladies Bible study, children's church, 1 semester of clinical teaching, first aid course that I did in Nicaragua. So I did this teaching presentation at Milwaukee Area Technical College in Mequon, and I had to give this presentation to 11 third semester students, which did have some knowledge, which was a little scary to me. And several were licensed practical nurses, and when I was first there, their responses were so good when she would ask critical thinking questions, which made me a little nervous when I was going to have to present. And then some of them were nurses' aides, some of them were the diversity of the group, even though there was such a small group, which was nicer to present to, was immense. Like there was 2 or 3 English as a second language, a couple LPNs, some CNAs. There was 1 male, African American, Chinese, Spanish, Caucasian. It just was a smorgasbord. Some were married, some weren't married, some had kids, some worked, some didn't work. Some only clinical experience was in the nursing program. The average age was about 30. And the classroom that I taught in, it was about a medium-sized classroom and only had 1 door access at the front, no windows. The computer and projector screen was in front where the teacher stood with a desk. There was a whiteboard. Students had tables. There was 3 rectangular tables with rolling seats for the students, and there was microphones that I did never see used, but they were in front of the students, and the temperature was usually cool and comfortable. The noise factor was pretty quiet because it was a small class. So the subject that I taught was part of an advanced course in this nursing program, and it was talking about vitamin B deficiency, folic acid deficiency, sickle cell, and aplastic anemia. So the way it was fit into the curriculum, this was probably like two-thirds of the way through. So the students had already had their pain, fluid electrolyte, cardiac, respiratory, which fits really good with the anemia lecture before this. And of course, since they're going to be graduating in 2018, they had already had their nutrition courses, their foundation communication skills. So this was cognitively constructed, and it was pretty brilliant how it built into the curriculum, and I think it's going to stay that way. So the subject of anemia is theoretical and practical. Anemia has the practical assessment component that the student need to learn to make critical thinking decisions in practice, but it also has the theory that has pathophys, lab, diagnostics, clinical manifestations, nursing diagnosis, and potential complications. So it's also divergent and convergent in nature, meaning that it's convergent because you're looking at labs, history, patient assessments to come up with one solution or one treatment for this patient, but it also has an individuality component which makes it divergent because people vary in age, gender, ethnicity, personalities, sizes, genetics, which change the solution of their diet or their teaching or how we communicate versus an adult versus a child. So this had a large amount of information on it that I had to give to these students. So my learning objectives were to identify your personal learning style. I thought it was important for them to realize that at the beginning, and that would help me understand their learning as well and what would work well with them, even though I only had one time with them for the lecture period. So second objective was apply the pathophys and how it relates to the clinical manifestations and treatments of iron deficiency, megaloblastic sickle cell, aplastic, and anemia of chronic disease. Third, there was identify the age-related changes that affect patients with anemia. And fourth, there was differentiate between iron deficiency anemia, megaloblastic anemia, aplastic sickle cell anemia, and anemia of chronic diseases based on the etiology and the diagnostic test and manifestations and potential complications. Now, these were some of the criteria that I had to meet for MATC's lecture. Lastly, I added create a nursing care plan for patients with these kinds of anemias because I wanted to connect that clinical component with the theory. So the teaching strategies were FINKS. So I smashed as many as I could into the informational gathering section. The text reading I gave the students, anemia PowerPoint, Medline web links that talked about anemia, talked about patient teaching, talked about clinical manifestations. I wanted to give the content in a variety of ways because these were such a diverse group. I wanted to try to meet all their learning needs. The Mayo Clinic web link was another way to present what anemia is, clinical manifestations. I gave 4 Khan Academy videos talking about pathophys and different types of anemia. And I also gave a nursing care plan link to prepare them for their activity, a web link to explain a bone marrow test as well, because they're going to have to do that with their patients. So I wanted to give that. I also gave them an article, an evidence-based article on elderly patients with anemia, which was part of the informational gathering that they were going to need for an assessment later, so I was making that connection. I also gave them an optional quiz, 2 of them, to do online if they were really ambitious students. And those were optional. So for my experience portion of the class, I planned on doing the BARC questionnaire, a discussion activity, and using groups, small little groups, because that way they could have that peer feedback, and also then we could have a whole discussion at the end, and then I could give my feedback so they knew if their learning was correct or not, and can provide that in a caring way to them to solidify their learning. Also a quiz on anemia to help them feel like they met their goal of knowledge. And I wanted to show 2 short patient story videos to put that human element in there, and I did the care plan group activity so that they could work together in groups and also think about connecting what they just learned to the clinical setting. And the reflection I chose was one that was a self-reflection on their learning. I wanted them, did you feel like you met your learning objectives? I wanted them to think about their learning and then think what they learned and see if they met them, and then explain how they met them so that they could understand how they learned. And also, I wanted the ones that didn't think that they met their objectives to explain or think about how they were going to learn them. So reflect on their learning and kind of instill that lifelong learning thought process in them. So what did happen? Well, what happened was my 2-hour lecture ended up being an hour-and-a-half lecture, and I had to stop. I did get to do the BARC questionnaire quiz on their cell phones at the beginning of the class, so they did get to learn their learning styles, so I was really disappointed. After my presentation, I spoke to my preceptor, and she said I could do the discussion activity, but I couldn't do it the way that I wanted to. The students had to do it on their own, and then they could come in and I would do, I'd go over the answers with them and they could provide the feedback that way, which ended up working out fine. We did do the anemia quiz, and the 1-minute paper was too, I don't know, it was after the fact because I gave it to them, but they were like running out the door, so they had a very long lecture and a very long day. So I did get them back, some of them back, which was good because I did get some feedback on that, and I'll tell you about that at the end. And I did do the care plan activity. I was able to give them out, and they started working on them in groups, but it was only 5 or 10 minutes left of class, so we didn't get to do the feedback component that I really wanted to do. But they did get some peer input into that, which I think that was still important. So some of my final reflections, what would I love to add next time? Time, but just kidding. Simulation and role play would be really excellent to make that connection between the theory and the practical component. How did the presentation went? I felt that it went particularly well because the students did love the activities that I gave them. It was a chance for them to practice what they knew and to learn about their learning. The lecture gave me an opportunity to use technology and my communication skills. The quiz was a way for them to measure their learning. The care plan was still an okay activity. They were able to have some peer feedback and make a little connection to the clinical setting. The discussion activity went really well. I was able to give rationales. They were able to give rationales. We had an open discussion, and so I felt like that really went well. The 1-minute reflection was really good for me because it gave me feedback on my teaching, the gaps in what the students liked, and they gave me some good feedback. Some of them did like the care plan even though they didn't get to finish it, so I would use that again. And some of them did like the videos that we got to present. Some of them did like the quiz. Some of them liked the article. Some of them liked the discussion activity. One student said she didn't meet the learning objectives, but she was well on her way to studying for the test, because we know that's the goal of these students, is to pass their test and pass the boards and then become a nurse. So even though I didn't feel like everything went perfectly according to the map, I feel like it gives me a better understanding of time it takes to do these experiences, teaching me to be flexible, knowing that there might be some unplanned events that do happen, and helps me use my critical thinking skills on what to make the lesson work. I would probably do a list on the things that I absolutely want to give no matter what. But I did believe the students did understand what the big deal was with anemia, and they were able to be encouraged that they can improve the outcomes for anemia patients. Okay, thank you. Have a nice day. Hi, I just wanted to give you my last reference page. I meant to do that and it didn't switch over for me. So, all right.